We're learning more about the expansion of Lane County's mobile crisis response team. The program, which launched in August, has already handled more than 1,300 calls, and it's set to expand to 24/7 service by June. Thank you for joining us tonight. I'm Matt Templeman. Reporter Madison Yeesh shows us how this new program has had to be conscious about funding amidst state and federal cuts.
You've reached the Lane County Crisis Line. If this is a medical emergency, please hang up and dial 911. Your call will be connected to a crisis line responder soon. Typical wait times are under 60 seconds. Thank you for your patience while we connect you to a responder.
In just a few months, Lane County's mobile crisis response program has expanded from just partial coverage to nearly 24/7 service. But with state and local budgets stretched thin, officials tell me they've created a plan to make sure that the program remains viable in the long term.
Basically, we're covering all hours of the day except for 11 p.m. to 6 a.m. That last piece is slated to happen in June. And so that will bring us up to 24/7 coverage.
The program pairs a mental health specialist with peer support to respond to crisis calls, often in place of law enforcement. But officials say they had to be conscious of funding as they developed and expanded the program.
So before we start a service, before we build a building, before we buy a van, whatever we do, we really look at that viability and making sure that the service, once introduced and once it becomes a staple as part of a service delivery in our community, that can be relied upon. And so we were very strategic in how we are funded.
The thoughtful use of funds has become even more important in light of recent state and federal budget uncertainty.
We have seen over the last couple of months that things that we once thought were rote and part of the fabric of what we do could be upended. It has challenged us to be even more deliberate about that future planning.
Officials say the need for crisis services continues to grow, and they're already looking at the next steps, creating a stabilization center where people can get help beyond just that initial contact. In Eugene, I'm Madison Yeesh.